joining us for this community briefing on COVID-19, and thank you to Margie Propp for providing your interpretation services for our community. Today, we regret to announce 3 additional community member deaths, bringing our total to 73. It's worth noting that 49 of these deaths occurred during October and November. That's 67% of all deaths in Lincoln and Lancaster County since the pandemic began. Once again, we extend our deepest condolences to all those who've lost loved ones to this disease. As we announced last Friday, our community remains in the red area of the COVID-19 risk dial for a 3rd week, indicating a severe risk of virus transmission in Lincoln and Lancaster County. What should be clear to everyone by this point is that our situation is critical and that we are dealing with right now is uncontrolled spread of COVID-19 in our community. Our data has continued to trend in the wrong direction. We have tried to implement new measures incrementally to turn these numbers around. We have asked for your help. What's clear is that we collectively need to do more to turn this situation around. Just consider our numbers from the past 3 weeks. Every day, our 7-day rolling average of COVID patients has increased. Our positivity rate has been near or above 25%. Case counts have set new records each week that's true for the past 3 weeks, it's also true for the past 5 weeks. Our hospital system is stressed, and every week it gets worse, as the doctors and ICU nurses and hospital leaders who've spoken here alongside us have shared with you in recent days. I'd like to stand before you today and tell a different story, but these numbers control the narrative. Based on our health team's analysis of them, we have no indication that our case numbers, positivity rate, and hospitalizations have peaked. We do not have reason to believe that things are going to get better without further action. We hear our healthcare professionals. The situation is critical. They need our support, and the only way we can protect our healthcare system is to turn these numbers around and prevent further illness that leads to hospitalizations. To slow the spread of the virus, to prevent illness and further hospitalizations, we are announcing today more changes to our local directed health measure, changes that go into effect at 12:01 a.m. Wednesday, tomorrow. We must act quickly. Health Director Pat Lopez is here to outline the changes in our DHM.
Thank you, Mayor. I want to begin today by thanking all those individuals, businesses, and organizations who are taking the necessary precautions to keep themselves and others safe. Unfortunately, the data shows that too many people are letting their guard down. They are being less careful and they are taking more risks. Our entire community is feeling the impact of their actions. At the end of October, the 7-day rolling average of new daily cases was 124. At the end of last week, the average was up to 278. That's a 125% increase. For the week ending October 31st, we had 890 new cases. For the week ending November 21st, our number of new cases has more than doubled to 1,861. Today, we have 226 new confirmed cases reported for a total of 15,061. Our positivity rate has also more than doubled from 13.3% for the week ending October 24th to 27.4% the week ending November 21st. Finally, we are seeing steep increases in the number of COVID-19 patients hospitalized, from 84 on October 31st to 170 on November 21st. On Monday, we had 176 patients, and today we have 164. We need every person to take this virus seriously in order for us to keep our community safe. Given the status of our community's outbreak, we don't believe we can wait any longer to implement additional measures to stem the spread of the virus. The following changes to our directed health measure will be in effect from 12:01 a.m. Wednesday through December 18th. Alcohol sales at bars that do not sell food are limited to carryout. Bars that sell food and restaurants must stop serving on premises alcohol beverages at 8:45 p.m. and must close by 9 p.m. But they may offer takeout and delivery for food and alcohol orders after 9 p.m. Gyms are limited to the greater of 25% occupancy or 10 people, excluding employees. Individuals must maintain at least 6 feet of distance from others at all times, and no indoor contact or limited contact team sports like basketball or volleyball are allowed. This applies to all ages. Indoor gatherings are limited to no more than 10 people, excluding employees. Gatherings in confined outdoor spaces are limited to no more than 25 people. Exceptions to that include schools, grocery and retail stores, offices, and factories, and all are listed at covid19.lincoln.ne, not gov. All large events continue to be postponed. Individuals must wear masks indoors unless no one else is in the same room, and they can maintain at least 6 feet of separation from others at all times. Indoor youth sports activities remain postponed until December 7th, and this measure will be reevaluated before that date. In addition to following our directed health measure, it is critical that all of us in Lincoln and Lancaster County avoid activities outside the home unless traveling for work, school, food, or medical care, or to check on others who may need assistance. Be diligent in following the 3 W's. Wear a mask, watch your distance, and wash your hands. Also be committed to avoiding the 3 C's: crowded places, confined spaces, and close contact. For older adults, anyone with underlying health conditions and other populations at heightened risk from COVID-19, please stay home. Rely on help from family or friends for needs outside the home. Distance yourself from household members that work outside of the home and wear a face mask around other people. Slowing the transmission of the virus requires a significant shift in behavior. We are all at risk, and as a community, we must do our part.
Thank you, Director Lopez. Many have asked us to produce granular data on the specific places or organizations, the bars, the businesses, the teams, the venues, where the transmission is happening. And while our health team continues to support specific organizations that need our help in managing viral transmission, what we need you to understand now is that the outbreak is so widespread and so severe that we are looking at more widespread measures. We're not in the position we were back in the spring, where we were reporting out a specific location that we could notify the public of to help them steer clear and stay safe. What we are in now is a situation where anytime you're outside of your home, the risk for transmission is severe. And the measures that Director Lopez announced today, the underlying principle of these measures is to reduce our contact with other people outside our household. And I appreciate that this is a really, really difficult thing to do. We realize that a lot of people's ability to make a living are impacted by these measures. But our data and our healthcare professionals are really clear that we need to take these steps temporarily to protect lives and to prevent the collapse of our healthcare system, to prevent more businesses from having to close their doors, to help keep schools open, and to answer the call from the doctors and nurses who've shared their experiences of what it's like to try to sustain life in an ICU. We ask that everyone in our community faithfully adhere to these measures and do an even better job of practicing the proven strategies that prevent the spread of this disease and that protect our families, our friends, our loved ones, our neighbors. Practice the 3 W's. Wear a mask, wash your hands, and watch your distance, keeping 6 feet from others. Avoid the 3 C's. Avoid confined spaces, crowded places, and close contact. No one of these steps can prevent 100% of the risk, but layered upon layer, each of these plays a role in building a wall of defense that is strong. We do have power against this virus. This also includes showing care for our loved ones this year by celebrating Thanksgiving a little differently. Again, this is going to be hard. It's not what we want. It's what we need to do. We enjoy being together, but if everyone can adopt these measures and follow these safety practices, then the restrictions that we're putting in place today can be shorter-lived. We will be able to open things up again more quickly, and that's what everyone wants. It's in our hands to make a difference, and we have the best chances of beating this virus if everyone works together to abide by these temporary changes. Now is the time to show our love and care for one another by not gathering and by being mindful of the simple, common sense steps we can take to prevent the spread. And with that, I'd be happy to open it up for questions.
Hi, this is Bailey Bischoff with 1011.
Bailey.
Hello. I am talking with some teachers today who are deeply concerned about students heading back to schools after Thanksgiving. The superintendent has said that he plans to keep schools open unless directed to do otherwise by the health department. Is it safe for students to be going back to schools after potentially gathering with family members for Thanksgiving? Is there any chance plans for that could change?
I'll have Director Lopez come up and speak about this in just a moment. But what I want to say to everyone is that the level of risk in any environment depends upon the choices we make. The choices we make today and tomorrow and the day after that. We have power over this virus. We have power to mitigate the risk no matter where we are by wearing masks, washing our hands, and watching our distance, and avoiding close contact and confined spaces with poor ventilation. Our schools and our health team have worked side by side for months to ensure that the environment in schools is structured and as safe as possible to mitigate the risk. Is there a 100% chance that everyone is safe? No one can say that. But we do know that there are wonderful safeguards in place in our schools, that people are taking concern through administrative controls, engineering controls, and safe practices that as students and teachers follow, protect people in those structured environments. Where we have seen transmission occur more frequently is outside of those structured environments, where those administrative and engineering controls are not necessarily in place, or where people let their guard down. I'll let Director Lopez speak more to the question of schools and her work with schools, not just LPS, but throughout the county.
Hi, Bailey. I think the mayor provided a great summary of the work we've done, and we did meet with all the administrators last Friday, as we do weekly, and talked about parents traveling and what we could expect when school comes back. And I think what the mayor said was what we came back to was that we do have these safety measures in place in school. We have monitoring measures in school. So I would urge teachers and students, and I would urge parents to follow the guidelines that have been given them to monitor their children before sending them back. I think this is a total community effort. Everybody wants to do certain things, but we also need to think about others that we're placing at risk. We still believe school is the safest place for students. If we see something change, we are going to act immediately and share that information with the administrators, and I have every confidence that they will respond accordingly.
This is Riley from the Journal-Star with a question for the mayor.
Hi, Riley.
Hi, Mayor. In the last few weeks, a lot has been said, particularly from owners of bars about the potential devastation to their business of another closure. Within City Hall, are you prepared to or exploring any economic relief that at the local level that could help support them, and or what measures, what do you say to those who are worried their business will be done for good after this?
I share their concern. We've done everything we can to avoid getting to this place, and yet here we are. We can't get away from this place without everyone in our community taking further action to protect each other, not just individuals, but our businesses. This is very serious. We are in a situation that is critical. And recognizing that certain businesses are being impacted disproportionately because of the conditions present. You know, I mentioned school has all this structured environment and protections and administrative and engineering controls. Bars, by their nature, although we have worked with them to try to make sure that they can be as safe as possible, by their very nature, are more conducive to the spread of the virus. People pull off their masks to drink. People lean in to hear because it's loud. People shout because it's loud. People get up to order drinks. People go to gather. All over the globe, bars have been an issue and a place of spread. We regret that that is the reality. And as to support for them, we have continued to advocate that the state and the governor, with his share of the coronavirus relief funds, direct more rounds of funding to impacted businesses like bars and restaurants. And to that end, he has directed a second round of funding to bars and restaurants. And I believe those disbursements will be coming. We certainly want help from our federal partners because while there is the promise of a vaccine, a promise of hope on the horizon, we need to take these difficult steps right now until we reach that horizon. We will look at what's possible at the local level, but we do not have any funding immediately available to us to direct to those businesses.
Mayor and Pat, Andrew Ozaki from KETV. Just a little clarification. How does this new directive affect Nebraska basketball, Nebraska football practices for like the volleyball team?
I'll have Director Lopez come up and answer your question. Thank you, Andrew.
Andrew, just to clarify, are you talking about the university?
Yes.
This measure, we haven't addressed the collegiate teams in this measure.
So this is only for club sports and for high school, or
We're
I mean,
talking about high school. I think we've been real clear about that, K through 12.
Pat, it's Riley from the Journal Star. On just an immediate follow-up, can you explain the thinking there in the reason that you're sort of governing only the youth K-12 club and high and school affiliated sports?
Well, because at the university, the athletes are tested every day. And so we know their status and their positivity. They also have restrictions which are much different than club sports and team sports in K through 12. They all have their own bubble that they stay in. I'm not saying that there isn't a positive case now and then, but we have to remember it's much different than the environment that we're talking about in K through 12 with club sports and team sports outside of a collegiate setting. Well, and spectator limited as well. The Big Ten has, as you've heard with the football, there's only 4 spectators allowed.
Pat, on a different note, today there's some news coming out about an outbreak at the Lancaster Rehabilitation Center.
Yeah.
Can you address what the status is among the long-term care facilities, and can you speak specifically to that outbreak? I mean, how bad it is, and if there's any deaths associated with it?
I don't have any deaths to report related to that. So far, of our 73 deaths in the community, 13 of those deaths have been attributed to long-term care, so about 18%. The Lancaster County, the Manor our rehab center outbreak, we have the team that's working with them really closely to contain the spread of the virus. That outbreak has just been ongoing in the past 2 weeks. So it is being contained now. And I want to remind everyone that our long-term care centers are doing testing twice a week with their staff, and then more often when they do have a situation where they have more cases within their facilities.
Do you have a case count for the Lancaster County or the Lancaster Rehabilitation Center?
You know, I want to talk with them. I think you've probably seen the release that they've posted, and they did not reveal a case count in there. But we're working with them, and we know that there are 41 individuals at this point.
And they deferred that comment to you to address the number of cases in the health department?
You know, I'm just saw the press release like you did. We've been working with the Long-Term Care Association in Lancaster County Rehab. I'm not sure what their decision-making process was for that. And I think you also probably saw that Legacy Terrace reported that they've had 26 residents with the virus and 1 death. So we encourage long-term care centers when they have an outbreak situation to share that information with the community. They already share it with the residents and the residents' family members. But I think it's important for the community to know what's happening in our long-term care centers.
Pat, this is Andrew again. How do you hold individuals responsible for doing the right thing? I mean, you know, businesses are paying a heavy price for this, but how do you hold individuals to do the same thing?
Well, I think all of us have a responsibility, and if we want to visit a business and we want it to remain open, then our actions are actually influencing what can happen and continue to occur for the business.
Would issuing more individual tickets or citations, would that help?
That's not something we have put in the DHM at this point. That's always can be discussed, but our issue isn't to do that. It's to really expect people to do the right thing and make sure that the businesses are having a safe environment for the people that are coming in.
This is Brent with Channel 8. The mayor, I think, mentioned more widespread measures are possible. Has there been anything specific identified as far as what could come next?
No, I think the mayor was referring, Brent, to what we are talking about today, that these widespread measures are the ones that we have to take now.
Gotcha. Okay, thanks for clarifying.
And of course, we'll continue to monitor other measures that come from the state and see where we're at in our community as well.
Director
Director,
Lopez.
this is Bill with 1011.
Okay. Bill, are you want?
Yeah, I'm here. I had a question about hospitalizations. It seems the past couple of weeks, it's been almost 1/3 Lancaster County residents, 2/3 people from outside the county. Looking at today's data, it looks like it's more 50-50. Can you
Right.
attribute that rise to anything?
Well, it's due to the widespread that's happening in our communities. And some of the critical access hospitals, you know, are continuing. We've worked with them to be able to take care of less critically ill in their facilities. But the change that you're seeing, Bill, you might recall a couple of weeks ago, we were seeing some of the same thing on the rise. And that's what's happening now because we have such widespread numbers. When you look at our numbers, they more than doubled, you know, in the last, since we moved from orange on October 31st in our community. So once that starts happening again with that rise in numbers in cases, we're going to see a subsequent rise in people that are hospitalized. And that's what we're on the precipice of right now, and that's why it's extremely critical. Even across our state, some of our hospitals really have no more room.
This is Andrew from Channel 7 again. There's some cities in California that'll look at curfews or lockdowns. Would there ever come a point where you guys might consider something like that?
You know, Andrew, just being really honest, that is not anything we've ever discussed. I think, you know, we know our community responds. We know it's been really hard and it's been a difficult time now, but I see signs of our community's responses. When Muchachos decided to go to dine out only, they've been busy and sold out almost every night. So a large sector of our community in Lincoln really does respond.
This is Brent with Channel 8. It seems like we've set our record highs for cases on weekends. Is that just simply more people are going out on weekends? Is that you know, just coincidental timing with contact tracing, or can you provide any insight as to why that might be?
Brent, that's when the cases come in to us. You know, and about we've had a lot of issues. I think you've seen when we say there's been technical issues with receiving the data from the state. You know, the data flows into the state and then out to us. So that's what you've seen on the weekends when we've had those occurrences.
Director Lopez, how does the 10-person indoor gathering rule dovetail with Thanksgiving gatherings? I mean, are homes exempt from that, or are people going to be encouraged to complain about large Thanksgiving gatherings in the county they know of?
Homes are exempt. You know, I think we've said over and over, trying to tell families that they should limit their situation, limit their gatherings to those only in their household. If they have others in, they should be 6 foot apart. I would hope that everything we've been saying has really discouraged. You know, my Thanksgiving is usually 60 people. And it's going to be maybe 2 and maybe 1 more than that. So, you know, unless we have some others who've been positive, and we can be outside, but very small, you know, and I think many of the people I know are only planning on having their immediate family with them and doing Zoom things. And I would really encourage people with the widespread outbreak that we have in the community to follow that. Too many times we hear people were together and then the next day they find out the person they were eating with is positive for COVID. Then they're in quarantine and awaiting a test result and become positive. So just stay with those within your immediate household. And no, we aren't going to be out looking at private residences.
And Director Lopez, Andrew from Channel 7 again. Sorry to keep on picking on you here, but hey, I'm hearing some, you know, with the Test Nebraska site in Lincoln, apparently, you know, with this colder weather that we've had, it's some of the conditions are maybe not the best for some of those workers out there. Have you heard the same thing? And what kind of things are you guys doing to maybe help, you know, mitigate that a little bit for some of those workers out there?
You know, we work closely with the state who has control over Test Nebraska. We've guided and assisted in all the things so they can be located here, so our community has access to testing. I have to say, they just moved a brand new pod garages into the testing site. The staff are in an enclosed area now with heaters in it, and they're probably needing to do a few adjustments. This happened on Sunday. So I imagine that it's going to work exactly like the one in Omaha has, and it's been very well received there. So we're just in, our third day of operations, so I know they've been making some adjustments. So we moved that and we brought that together for the workers to have a more comfortable environment.
Director Lopez, DHM questions. It's Riley again. The alcohol sales restriction is, if I'm hearing you right, essentially, if I'm an alcohol sales only establishment, I can do takeout beers or margaritas until from regular hours I could otherwise serve, so 6 a.m. to 2 a.m.?
Bars only, if I'm hearing,
So bars could do takeout alcohol sales for the entirety of their otherwise non-pandemic operation hours.
if I'm understanding you correctly, yes.
Okay. I think not the most artful way to ask it, but I think yeah. Second question.
Bars can sell takeout.
Okay. Yeah, and there's no deadline or closing hour for when they're cut off if they're doing takeout.
Right.
Okay. Second question, what level of compliance has the health department seen with the youth sports postponement? I know that there was some concern last week about people trying to skirt that and get around it. And does the gym restriction sort of address some of those problems?
You know, Riley, we've had a couple complaints, but in general, no. We haven't had very many unless we haven't heard about them yet. But in general, no, we haven't had a large number of complaints.
Pat, this is Bill again. I did have a follow-up DHM question on the no contact sports. That was gym specific through December 18th. And then the youth sports K through 12 stuff, that still has a December 7th date, correct?
That's correct, Bill.
And are you guys going to address that in the weeks to come, whether that continues or is allowed to expire?
Yes, and we're continuously reviewing that and the information. We're in the contact tracing, and we'll be formulating how we can go forward on December 7th.
Thank you, Pat.
Earlier, I mentioned that we don't have resources immediately available to us for businesses, but I do want to mention that we do have, through federal grants available for rent and utilities, an assistance program. If you go to covid19.lincoln.ne.gov and go into resident resources, you can find more information about how to access support for paying rent and utilities if that is a need that individuals in our community face. Other questions?
I have a clarification here. The 9 p.m. closing time, does that apply to all restaurants or only those with liquor licenses?
All restaurants and bars that have food that fall into that category. Other questions? All right. Thank you for tuning in. Our hearts are with the families in our community and the businesses most affected. We all feel this personally and professionally, and we're doing everything in our power to get in control of this virus. We need your help. These measures will help if you faithfully adopt them and faithfully practice the 3 W's and avoid the 3 C's. Please celebrate Thanksgiving differently this year with the idea in mind that a vaccine is coming soon. It would be a shame if people got sick over the holidays and weeks later, months later, a vaccine is available that could have prevented illness and suffering or even death. We can do this. We do hard things. We are a strong community, and we will get through this together. Thank you.